Hi, I'm Garvin. This video is on insulin Lantus. So Lantus is available in vials as Lantus SoloStar pre-filled pens and Lantus penfill cartridges, and they all contain the active ingredient Glargine. They are used to treat diabetes. People with diabetes have a deficiency or absence of a hormone manufactured by the pancreas called insulin. Insulin is the main hormone responsible for the control of sugar or glucose in the blood. People with type 1 diabetes need to have injections of insulin to control the amount of glucose in their bloodstream. Insulin injections act as a replacement for natural insulin and allow people with diabetes to achieve normal blood glucose levels. Insulin injections work in the same way as natural insulin by binding to insulin receptors on cells in the body. Insulin causes cells in the liver, muscle and fat tissue to increase their uptake of glucose from the bloodstream. It also decreases the production of glucose by the liver and has various other effects that lower the amount of glucose in the blood. Lantus contains a type of insulin called Insulin Glargine. This is known as a long-acting insulin. When injected under the skin, it starts working within 2 to 3 hours and produces a steady effect for 25 hours. It is used to help provide background control of blood glucose throughout the day. Insulin Glargine is normally used in combination with short-acting insulin, which is given before meals to control the increase in blood glucose levels after eating. It is important to monitor your blood glucose regularly and adjust your insulin dose as required. So how do you use it? Your doctor or diabetes specialist will teach you how to administer your insulin injections correctly. Lantus is given once a day, at the same time each day. The injections are usually given under the skin of the upper arms, thighs, buttocks or abdomen. You should take care to make sure that the injection does not enter a blood vessel. The injection may start to work at different speeds depending on the site you use and various other factors, such as if you've been doing exercise. In general, injections into the abdomen start to work quicker than those given in other areas. You shouldn't massage the injection area after administration and injection. Each time you inject your insulin, make sure you use a different site. This helps to prevent the skin thickening and pitting, which can occur if the injection is repeatedly given in the same site. You should measure your blood sugar levels every day when using insulin injections. The dose you need to inject each time will depend on your blood sugar levels, what you are going to eat, and if you have been doing or will be doing exercise. Your insulin requirements may increase when you are ill, especially if you have an injection or fever. Your insulin dose may also need adjusting during periods of emotional disturbance, or if you increase your physical activity or change your usual diet. Insulin requirements may be reduced if you have impaired kidney or liver function. Discuss this with your doctor or diabetes nurse, or make sure you optimize control of your blood sugar. It's not to be used in low blood sugar levels or hypoglycemia. So this medicine should not be used if you are allergic to any of its ingredients. If you feel you have experienced an allergic reaction, stop using this medicine and inform your doctor or pharmacist immediately. For pregnancy and breastfeeding, this type of insulin should be used with caution during pregnancy because it is relatively new and has not been specifically studied in pregnant women. A different type of long-acting insulin with known safety during pregnancy may be preferable, but you should discuss this with your doctor. There is no risk to nursing infants from insulin taken by the mother. However, your insulin dose may need to be decreased during breastfeeding. So for side effects, medicines and or possible side effects can affect individual people in different ways. The following are some of the side effects that are known to be associated with this medicine. Just because a side effect is stated here, it does not mean that all people using this medicine will experience that or any side effect. So, low blood glucose level or hypoglycemia, redness, swelling or itching at the injection site, skin thickening or pitting if injection given too frequently into the same site, loss of fatty tissue if injection given too frequently into the same site again, Rare side effects would be allergic reaction such as skin rash or hives, chest tightness, shortness of breath, or severe allergic reactions such as anaphylaxis, visual disturbance, excessive fluid retention in the body resulting in swelling. And very rare side effect would be a pain in the muscles, which is myalgia, change in taste sensation. So how can this medicine affect other medicines? Insulin itself doesn't affect other medicines. However, it is important to be aware that many medicines can affect blood glucose levels and can therefore change your insulin requirements. For this reason, people with diabetes should always seek advice from the doctor or pharmacist before taking any new medicines or stopping existing ones. The following medicines may decrease blood sugar levels. If you start treatment with any of these, your insulin dose may therefore need decreasing. ACE inhibitors, these can sometimes cause unpredictable drops in blood sugar. Anabolic steroids, such as testosterone. Anti-diabetic medicines taken orally. Disopyramide, fibrates, fluoxetine, monoamine oxidase inhibitor antidepressants, and large doses of salicylates, e.g. aspirin. Small pain-relieving doses do not normally have this effect. Beta blockers, such as propranolol, including eye drops containing beta blockers, can mask some of the signs of low blood sugar, such as increased heart rate and tremor. They also prolong episodes of low blood sugar and impair recovery back to normal glucose levels. The following medicines may increase blood glucose levels. If you start treatment with any of these, your insulin dose may therefore need increasing. Some antipsychotic medicines such as chlorpromazine and olanzapine, corticosteroids such as prednisolone, danazol, the diuretics, especially thiazide diuretics, which is bendrofluomethazide, isoniazid, lithium, protease inhibitors, example ritonavir, somatriptan, a human growth hormone, estrogens and progestogens, such as those contained in oral contraceptives, may affect blood sugar levels, and women taking these may need small amount of adjustments up or down in their insulin dose. So how do I store Lantus? Pre-filled pens, unused pre-filled pens should be stored in a refrigerator at 2 to 8 degrees Celsius. Do not freeze. Keep the pen in the outer carton to protect it from light. Once in use, the pens should be kept out of the fridge below 25 degrees. They can be used for up to 28 days. The pen cap must be put back on the pen after each injection in order to protect it from light. The pens should not be stored with the needle attached and should not be kept in the fridge once in use. Cartridges, before use, cartridges should be stored in a refrigerator at 2 to 8 degrees. Do not freeze them. Keep the cartridges in the outer carton to protect them from light. And once in use, the pen with the inserted cartridge should be kept out of the fridge below 25 degrees Celsius. It can be used for up to 28 days. The pen cap must be put back on the pen after each injection in order to protect it from light. The pen should not be stored with the needle attached. Make sure all medicines are kept out of reach of children and avoid exposing them to excessive heat or direct sunlight. So if you have any questions, you can ask me through the live pharmacist on the website. You can email me or contact or just come into the pharmacy in Broaddale and Douglas up near Braille in Cork. Thank you for watching.